Okay. Hi, Loretta.
Hi.
May I ask you a few questions?
Sure.
So please tell us what is your name, what is your background, where are you from, and what did you do in Slovakia, please?
My name is Loretta Caine. I am from Jackson, Mississippi, United States. I just graduated with my Master's in Public Health Epidemiology background. And I've been here in Slovakia to help with the Roma Indoor Air Quality Project.
Okay, so you are a part of some kind of program, or what is the reason that you are here in Slovakia?
Yes, I'm a MHRIT student. That's a Minority Health International Research Training program, and through the University of Iowa. So I found the program on the internet, and I applied. And since I have a public health background, Slovakia was doing a public health project, and so it was the best fit for me.
Did you have information about Slovakia before your coming here?
Brief information. I did an internet search before I came here, and that's the only information I had. I knew this Czechoslovakia before I came here, and so I found out later the Czech Republic and Slovak Republic is now split. So.
Do you know something more about the MHRIT program for students?
Actually, I think there are about 15 to 20 schools who host the MHRIT program in different areas. Some are public health, some are biomedical sciences, other sciences. And I was interested in the University of Iowa's program because they had a public health sector.
Do you think that the MHRIT program is important for students?
Definitely. It gives U.S. students an opportunity to go beyond what they know, culturally, academically, professionally, and they get a chance to go to various international sites and learn more about different cultures.
Okay. Could you please tell us something more about your activities here from the beginning until now?
Well, after this first week, I went to the Hatatras in Profi, Slovakia. That was a very good experience for me. I met with a team from Wisconsin, from the United States, and we had healthy family sessions in 3 separate Roma villages. We showed them how to wash themselves on a daily basis. We had dental hygiene classes, CPR classes, Heimlich maneuver classes, and at the end of each day, we would go into their community, pick a house, and paint a mural of the event to commemorate the experience.
So, do you have something similar? Do you have some similar communities in your country? Is it comparable?
Definitely. The Roma population is very much comparable to all the minority populations in the U.S. African American populations, Hispanic populations, Native American populations. They're usually the poorest populations, the worst in health, and worse neighborhoods, worse schools, etc. And I found that in the Roma population as well.
Do you think that here in Slovakia we can learn something from you, from your experiences, from your country? Do you have feeling that you are better in a way how to help to the community, how to develop community, or how to improve the health of the communities?
I wouldn't say better, I would say different. I think just being here has maybe given a different perspective on situations. Even when I go back home now, I can take what I learned here and give my academics and my professional life a different spin on things.
Okay, so maybe we can say that it's really important to exchange good practices.
Definitely.
To discuss about the topic
and
to learn from each
other, because we all have different ways of doing things, and what works for you might also work for me.
Okay. Do you have some other experiences from Slovakia?
Yes.
Or from other countries?
The Fogarty Summer Institute was a good experience. I had a chance to interact with other now colleagues from other countries and made collaborations on future grant proposals that we plan to actually continue. Some of my colleagues are from Poland, from Serbia, etc. And also I had a chance to travel while I was here. Milan, Italy, Paris, France, Budapest, Hungary, and Prague, Czech Republic. So those were great downtime.
Okay. Do you have something you can conclude your stay here, like some recommendations for other students which can visit our country or to be a part of MHRIT program?
I would definitely encourage any U.S. student to become a part of the MHRIT program, especially public health students. I found out that we assume that the systems are the same all over the world, and they're not. And that's the first thing I really found out here. Just being here just has opened my mind up to possibilities I never thought possible. Collaborations, networking, continuing on possible dissertations, grant proposals with international colleagues. Gave me a chance to experience other cultures, after the culture shocks, of course, but it gave me a chance to live in another culture and experience another culture and to lay down my prejudices about other cultures. So I definitely think it's a great opportunity for other students to experience what I've experienced this summer.
Okay, my last question is, please tell to our students message for Slovak students. What do you think, what they should or could do in their professional lives, or because you have met some Slovak students from public health department, so you had a possibility to work with them a little bit. Please tell to them some message.
I would tell them, if you can find an opportunity to visit an English-speaking country, to do that, because you guys have a unique situation. You have your own language, but most scientific publications are in English, and I would encourage them to do as much as possible to get over that language barrier. Being here was hard for me because I didn't know Slovak, but the students here have to learn English anyway, and I would just tell them to interact with as many English-speaking people as possible from different dialects all over the world, if they ever have the chance to travel and do that.
Okay, thanks for your kind information, and it was a pleasure to have you here at our department. So thanks again.
You're welcome.
See you next time.